everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Our exams are knocking at the door, and a lot of questions keep coming in. Miss Mary, I'm confused. I don't really know how to tackle my questions. Miss Mary, nursing diagnosis is a problem. Miss Mary, how do I go about nursing care plan? But this video in particular is going to be answering 1, 2, 3, 4 question type that pops up in your nursing and midwifery council exam. So if you are able to understand this video totally on how they set their various theoretical questions, that will go a long way in your exams to help you answer your question and make useful nursing diagnosis with ease. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Right, welcome back. Like I earlier said, today I'm going to be telling you how to make your nursing diagnosis, just knowing and understanding the question properly. So the first question we're going to be having on the board is, Madam Goji, a 30-year-old factory worker, was admitted into the ward with the following signs and symptoms: fever, cough, dyspnea, pleuritic chest pain. Sorry, there's a pleuritic chest pain, rapid pulse, and shortness of breath. Before I answer this question, the first thing I would like you to know is that whenever you get a question in the exam hall and it said you should create a nursing diagnosis, the first thing that should come to your mind is, what are the signs and symptoms given in the question? Even if you don't have the idea of what the disease condition is all about, but the first thing that should come to your mind is the signs and symptoms given. Looking at this question, it is obvious that the signs and symptoms are given. So the first thing you have to do is to cycle the signs and symptoms. That is what I normally use in my exams. So I tend to cycle them out. I have fever, I have cough, I have dyspnea, which is difficulty with breathing. I have pleuritic chest pain. I have rapid pulse, and I have shortness of breath. So that's the first thing you should ask yourself: are the signs and symptoms given? If the signs and symptoms are given, the next thing is for you to cycle out all the signs and symptoms for easy identification. So looking at this first one here, it is what? It is fever. That's to tell you that there is hyperthermia in your nursing diagnosis. And hyperthermia is usually related to the activation of the thermoregulatory center of the brain, evidenced by what? Temperature of 38 degrees Celsius. So looking at this one here, fever, it already shows that there is what? There is hyperthermia. Then looking at cough, dyspnea, shortness of breath, rapid pulse, that's already telling you that there's something going on with the breathing. So you are going to be having what? Ineffective breathing pattern. Looking at this now, they said there's pleuritic chest pain. That's to tell you that you are going to be having what? Acute pain. You can see from the signs and symptoms that we cycled out, we have what? In order of priority, we have ineffective breathing pattern, we have acute pain, and we have what? Hyperthermia. You can also add up anxiety. So if you check a question and the signs and symptoms are given, so that will give you a clue on what nursing diagnosis should come to your mind. For example, you are having somebody having what? Weight loss, anorexia, vomiting. That should give you a clue that there's a possibility for what? Imbalanced nutrition, less than body requirements. So if you're having somebody that is vomiting, that is bleeding, that should give you a clue that there's what? Deficient fluid follow. So the first thing you have to do is to what? Look at the question for signs and symptoms. And the next question that comes to your mind, Nurse Mercy Mary, what if the signs and symptoms are not given? The second thing I ask you to check when the signs and symptoms are not given is it an inflammatory condition? Is it having itis, inflammation? For example, your peritonitis, appendicitis, laryngitis. Those questions relating to inflammation, they have similar nursing diagnosis. For example, this question, Mr. Jago, a 45-year-old businessman, was brought to the emergency unit of your hospital with a complaint of acute abdominal pain, muscle rigidity, and localized rebound tenderness. After clinical assessment, a diagnosis of peritonitis was made. Let's ignore these signs and symptoms given, but we finally know that it has peritonitis. All the itis, most times, they have similar nursing diagnosis. They usually come alongside with pain. Itis comes alongside with pain. Itis comes alongside with hyperthermia. Then you can add anxiety. Are you getting? You can add what? Anxiety. So whenever you see an inflammatory condition, you get into the exam or you are stuck on what diagnosis to make, you should go for pain, you should go for hyperthermia, and you should go for anxiety. So remember, the first question you ask yourself, are the signs and symptoms given? If the signs and symptoms are not given, is it an inflammatory condition? And then the other question I would like to pop up, the signs and symptoms are not given. I don't know if it is an inflammatory condition. It's not an inflammatory condition. What do I do? So that is when you have to take note of the system this question is coming from. Because each system in the body has a peculiar nursing diagnosis. For example, you get a question like this. Emeka, a successful businessman, smokes 5 packets of cigarettes and drinks a bottle of gin every day. Wow. He rarely has time to eat his food. He is admitted into your ward with a diagnosis of gastric ulcer. Gastric ulcer is already telling that, this thing is coming from the digestive system. This thing is coming from the digestive system. So, depending on the system, they have similar nursing diagnoses. These are just clues to help you out if you are stranded in the exam hall on what diagnosis to give a patient. So, you ask yourself which system. This particular question is from digestive system. You can also get questions from cardiovascular system, from respiratory system. The big question is, how do I know this thing is from a particular system? There's usually a question following this the disease condition. Either they tell you to describe the heart, describe the stomach, describe the liver. So that should give you a clue to which system this particular question is coming from. And we all know, for those that have not watched the summary of the digestive system usually have similar diagnoses like acute pain, imbalanced nutrition less than body requirements, and also anxiety. So these are the nursing diagnoses peculiar with the digestive system. There are also other nursing diagnoses peculiar with other systems. So the first question you ask yourself is, are the signs and symptoms given? If not, is it an inflammatory condition? If not, which system is this question coming from? Then also, the last question here is talking about surgery. Whenever I see a post-op nursing diagnosis, I'm always elated. I'm always happy. Why? Because pre-operative and post-operative, they usually have similar nursing diagnosis. For example, let's look at this one. Mr. Etuk, a 60-year-old man and an alcoholic, was admitted to the hospital with a diagnosis of cancer of the larynx. He is booked for laryngectomy. They might tell you with the aid of a well-labeled they might tell you to bring out some useful nursing diagnosis, both pre and post. One of the common, the paparazzi pre-operative nursing diagnosis is anxiety. Because no matter what you say, Immediately a patient hears, oh, I'm going to the theater, he or she becomes very, very anxious. So anxiety related to the outcome of surgery, evidenced by patient facial expression, evidenced by patient asking too many questions, is one of the pre-operative nursing diagnosis. Then another diagnosis we have, it could be relating to the signs and symptoms given in the question. So the other question that comes from the surgery is actually post-op nursing care plan. So the post-op nursing care plan we usually have, because most patients are under the effect of anesthesia, we have ineffective breathing pattern related to the depressant effect of anesthesia, evidenced by dyspnea. You can have ineffective airway clearance related to obstruction by the tongue, evidenced by secretions coming out, evidenced by dyspnea. Then you can also have imbalanced nutrition, acute pain should come first. You can have acute pain related to surgical incision. You will agree with me that during surgery, a surgical incision is being made wherever it's going to take place. So acute pain related to surgical incision, evidenced by patient verbalization. You can also have imbalanced nutrition, less than body requirements. You can also have risks for infection. You can have impaired skin integrity. So the three post-op nursing diagnoses I usually put in my head is actually ineffective breathing pattern, acute pain, and imbalanced nutrition, less than body requirements. Don't forget, the summary of our class is, whenever you see a question on care plan, the first thing you should ask yourself is the signs and symptoms given? If the signs and symptoms are not given, is it an inflammatory condition? If it is not an inflammatory condition, which system is this particular question coming from? And also, don't forget your pre and post-op nursing diagnosis. Thank you very much for staying tuned. Thank you very much for watching our YouTube video. Don't forget to subscribe. Don't forget to like. Don't forget to share and watch with a friend if you got value. See you in our next video.